go ahead and we'll hear from Amy, and I'm sure she'll answer a lot of the questions that we have before we even get a chance to ask them. So turn it over to you, Amy.
Hello. It's nice to be on here this morning. I'll start by introducing myself. Of course, I'm Amy Scar. I have been a nurse for about 15 years. I started in the NICU. That is where my roots are. So I did take care of several babies with CF early in life, and then I kind of moved my way up to pediatrics and was a case manager, and then was kind of brought over to the CF Center and really have found that this is what I was meant to do. Absolutely love my job and the ability to be close with families and be there at all times for families. So I am very honored to be in this position. So I'm just going to tell you a little bit about our center. We are a pediatric center, but we also see adults just because in Iowa, University of Iowa is, the only adult center, and we feel if we've seen them, we will continue care. We will refer them on if need be, if there's too many different things going on past, pediatric kind of realm of care. But for the most part, we have about 80 under 18 and almost 20 adults that we see. Our clinic days are just Tuesday and Thursday morning. We do that from 8 to noon. And of course, with COVID, everything has been kind of, we've had to be very creative and change things around. So we stopped seeing patients in person in March when everything kind of closed down. And then here at the end of June, we started bringing patients in on a very reduced basis. But we started telehealth visits in April. So at first it was just over the phone, and then we added video. But then, time passes and you get concerned that we don't have up-to-date cultures. What if we miss something? We have to, still give you good care, but keep you safe. So we really put our heads together to start clinics with just a minimum amount of patients. So we only will bring in a max of 4 on Tuesdays and Thursdays. The times are spread out. A lot of times about 40 minutes between patients, and the rooms are very spread out as well. So just heightened our infection control that we already do, just to keep everybody safe. And our clinic was virtually empty other than bringing the CF patients in on Tuesdays and Thursdays. So very clean environment. That's changing as we go along. We're bringing more patients in, but still Tuesdays and Thursday mornings are dedicated to CF. So on our clinic days, the appointments are very long, painfully long for the families. And so when I started here about 4 years ago, I want to give the best care, but also respect time and get you out of here a little faster. So I am kind of what you would say a gentle whip cracker during the day, so that patients don't sit empty. They always have somebody in the room, and we're keeping things flowing and then their time respected so they can get out of here. So during our day, we have a multidisciplinary team, and it is, we pretty much orchestrate. We have a board that kind of helps us know who's in the room, who wants to go in next, so that I can direct and let everybody know when it's their turn to go in. So of that staff, of course, I am the coordinator. I kind of watch over everything that they would need: labs, x-rays, bronchoscopies, CTs, you name it, G-tube supplies, med refills, prior authorizations, all that good stuff. I have many spreadsheets to help me because there is a lot to watch over and help with. And so then during the day, I basically I function more at the end of the clinic to get them another appointment to see if there's anything they need. While when I started, I functioned at the beginning of the appointment because I wanted to know everybody and let them know who I was and how I'm here to help with everything. I have a direct phone line so that they do not have to call the front desk to, they can just get right through to me and I can help with whatever is needed. So then we also have a dietitian that's very important that helps with, keeping their BMI at a good level. This is so very important because the BMI and their lung function is so closely correlated. So we, really bring that forward in our appointment to kind of show where they're at. And, at some points, it's hard to, they look good, they don't look like they're skinny, but when that BMI is low, you can almost predict a kind of an illness coming. So we're really, really have a keen eye on the BMI for the patients. And I have the ability to give them smart reports through the registry that kind of shows that correlation, and it will show like past illnesses and how that correlates. So just the why of everything. We do a lot of teaching during the day. So not only BMI, she will go over healthy eating. Before they would push any high-fat food, and, we realize you can't live on McDonald's. So there's lots of healthy high-fat food that we like to encourage to, and then exercise to get lean muscle and healthy weight. So a little bit different focus over the years, but also we have a respiratory therapist that works with the kids to do PFTs, and we start practicing that about 3 at 3. It is, and I've done several now. The PFTs they're hard. They are a very hard thing to accomplish. The blowing out for 6 seconds, and so we start at 3. She has neat computer programs to help them kind of visualize blowing a balloon across the screen, or, lifting the sun up into the sky, that kind of thing, just visuals to help them practice. And our child life that is also with the kids during their appointments will help with the little pinwheels. She'll have bubbles to help them blow, lots of exercises to get them prepared. Some kids can do it at 4, and some we wait, a little longer. But then, of course, as soon as they can, that's one of the first things they do when they come. And that's, of course, put up on our board as well. And it gives everybody a good snapshot of how's their BMI and how's their lung function. So, we can kind of tailor our care, what is needed, just by what we see on the board. And of course, speak with family or patients about what their concerns are during the day. Our respiratory therapist also goes over cleaning of all the nebulizers and the filters in your nebulizer. She has them bring their equipment in once a year, and we have found a myriad of issues that we've caught that help. Like the vests are way too small. They're wearing a tube top and they're not getting where they need to be. Just lots of things to help keep them with the best care they possibly can. She also will kind of has a little quiz to do you know what meds you take and why you take them? Because the why helps with adherence. So we kind of we're working in the CF Rise program, which helps us. It has lots of tests that the kids can take that we can just see what they know and what do we need to teach them, because we don't want to assume everybody knows everything. So where where are you at in your care, and how can we help you understand, or what would you like to learn about? Then Leanne also will, after the tests are done, she'll give them again the next time, and the improvements, we see improvements, and we celebrate all those little wins with, with families, with the children. And, the clinic day we feel is so kind of focused on numbers and weight, and really we want to celebrate any good wins, and just how can we help you do that again next week? We're here to help and not look at what has happened but last week. Let's go forward and get you healthy. That's all we're worried about. We also have our physical therapist. Not every team has a physical therapist, so we are pretty fortunate. Lots of they do like a QI project with which is quality improvement projects with patients as to when they do a step test. So they do a 3-minute step test. They literally have a set of steps in the room, and they monitor heart rate, they monitor their recovery rate, their oximeter, their to see if it goes down when they do a test. And we've kind of had this ongoing for about 3 years, where any patient that starts on a modulator or can be Trikafta, that kind of thing, how we see improvement in recovery, just recovery rates once they start those modulators. But also patients that aren't on modulators, their rate of heart rate when they go up, how high they go, if this is not normal, it kind of predicts an illness. So we have lots of little things that we're watching with the patients to keep track of and see their recovery rates, that kind of thing. We also have our child life, who is just key with all of the things that we do, getting through sitting in that room for a while, lab draws, going to port flushes, you name it. She's there to help with them, and then also really teaches how the kids can gradually just own their own health, their own journey, pretty much. Then we have our gastrointestinal doctor will come on Tuesdays. He is here to help, of course, with enzymes and G-tube feedings and all kinds of stuff like that. We have him on Tuesdays, which we're very fortunate of that. And then our providers we have 2 nurse practitioners, Tara Eastfold and Kathleen Gradeville, and then Dr. Abasaida is our director, and then Dr. Salib functions as a co-director, but really sees kiddos when they're inpatient, if they get admitted to the hospital. So the day is really long, but lots of things are encompassed in the day, and of course, right now is annual lab time, and we're being very creative. Some families are not comfortable coming into the clinic right now, and that is absolutely fine. So we've even done things like having them, they drive up to our little drive up and we'll run down and get a culture from them. And so they won't have to come into the hospital. Um, just to be able to, we can't miss things that, like a Pseudomonas on a culture, we don't want that to sit and not have any attention. So we have different labs around Des Moines that I will, wherever they're comfortable, I will get their lab orders to, say they live in Grinnell, that's where they're going to go. That they don't have to drive to Des Moines, just so we can see that labs are in good shape, the culture we will be able to treat if an illness pops up. Yeah, pretty very, very flexible with families right now, and of course we can do telehealth visits as well. So, is there any questions about the CF day?
Amy, I don't have any that are typed in. Feel free to unmute yourself, everybody, and ask a question if you have any. So, Amy, I will ask you one question. So do you see telehealth and phone call type of appointments continuing after COVID? Or do you see it going back to what is normal?
I feel like it's a good option, but like Dr. Rotsaida, his main thing is he wants to listen. He wants to, hear at least, if something is going on, if an illness is happening. We aren't bringing any ill patients to our clinic, so it for a patient with CF, they can come in and they can feel safe here. We're not they have that respiratory clinic that we send any ill patients to, so they can come in and feel comfortable with being assessed, and we can even decrease the number of our staff that go in the room. I am not actually entering the rooms right now just because I just feel the less people in the room is better, and I can make an appointment outside the room. So, and I know everybody well. So, and these home spirometers that we have been gifted has been another great thing for patients that we see that have gotten ill. They really do correlate. The few that we've been able to have do one before they come into clinic, they do a PFT on their home spirometer, and then they do them here, and within a point or two, they are just right on. So we feel we can safely, not that we're not putting them in our computer, but it's a good piece of data for the providers to decide if they were going to treat or, if somebody's ill. So that is another thing that's helped us, with COVID going on. So I feel telehealth is going to be an option if you're not comfortable, absolutely. But there are a few things that we need, like the culture, which is very important. But of course, you don't have to get out of your car. We'll do whatever to get that information.
Sure. So Mary had a question. Once you do see an illness and somebody's hospitalized, what are some common reasons for needing to be hospitalized?
The common reasons for hospitalization, even so, at the beginning of our appointment, I will, like I said, put their BMI. That was their last appointment. I will put their last lung function. So if we see that that BMI has dropped like 10% and their lung function is down 10%, that is criteria for admission. It is, something's going on, something's missing, we're missing something. And, a lot of times if we'll try first with oral antibiotics. And if oral antibiotics and they're still not getting better, that's another criteria for admission. It's a failed oral antibiotics, really, and really the need for IV antibiotics is kind of, comes up, and they can't avoid it. So hospitalization, though, we're pretty flexible on. We can, at least the first couple days they need to be inpatient so they can start the medicine they need and then make sure they're giving a safe dose and everything is set up for home. But they can, most every patient we will send home to finish their antibiotics at home. There are a few that aren't as adherent that we want to see get the benefit of the schedule in the hospital. So we will keep them there. But most, we're very flexible with letting them go home and finish and not have to be stuck in the hospital the whole time.
So along with the BMI as a predictor for illness, can you explain anything more about the BMI and lung function connection?
Well, nutrition is so very important for you to fight an illness. And when that starts to decline, your body doesn't have as much fuel per se to fight an illness. So it just it's like a spiral. They kind of go down together just because you don't have that fuel to fight. So the better the BMI, the more that's what the CF Foundation found was over 50% in kids. So 50%, we use the percentage, not like when you get to adult, you're 22 and 23 for adults or women and men. So as a child, it's the percentage, which is a little bit different. Why 50 sounds so high, but they found that when that goes down, the probability of illness will go up. So that it's just that fuel to fight. That nutrition is so key.
We also have a question from Dan. He asks, are you seeing any patients that are on Trikafta? And if yes, what are you seeing in those patients?
Oh man, gives me goosebumps. The Trikafta, the change in patients, and we've of course seen great jumps in the lung function, even up to 10 to 12, 15%. Some haven't changed at all, but you can see in the color of the patient. You can see the weight start to put on. They stop coughing. They're just day to day walking around, not short of breath. Lots of good stuff. It just gives me goosebumps. Even on X-rays, Dr. Arbasaida, the results of the X-rays, the printout that comes with the X-ray, it'll say significant improvement from last exam, and that just gives me goosebumps. Like, that is huge because that takes out all the plugs, all the stuff that sits there and causes damage that you don't get back. So getting it out of there and being able to see those results improved are everybody. I can't even say, they just say they feel so much better, so much more energy during the day. They're more awake, and it's just amazing. It really is. Trikafta, we didn't hear that so much with the Orkambi, where we did see numbers go up here and there, but Trikafta has been a huge, huge difference for patients.
And then Mary had another question. Is there encouragement to exercise and be as active as possible?
Yes. I even track that from the appointment. My physical therapist works with families to do yoga or anything really that they prefer, and we'll track that in the registry. Where we don't want it to replace the vest, it just helps to keep things moving and looser, and So it is definitely important with nutrition, with pretty much every aspect, your mental health as well. The exercise does benefits in all areas.
So another question about Trikafta, because it does deserve the time.
Yeah.
So when do people see improvements when they are on Trikafta? Is it immediately, weeks, months?
Immediate. I swear, it's probably like 3 to 4 days. We'll hear them calling and saying, I coughed for like 2 to 3 days and now I don't have a cough. And then it's just kind of gradual after that. It's more, they notice some more energy, it just kind of, but it is very quick. Even some say I took it that first day and I knew it. I absolutely knew something was going on in my body. Um, so I haven't really heard anybody that it's taken a long, long time. It's right away, really.
So another question that I have that I've heard from some grandparents, what are some examples of some healthy, high-fat foods, both for meals and for snacks? What can the grandparents be doing in their house when they're with their grandkids?
Yes. So there's several high-fat foods. Of course, you have to take these modulators with high-fat foods. So make sure that all milk is full fat milk, full fat yogurt. All those, don't get the 1%. You want that good fat in there. Avocados are a wonderful option, although not sometimes kiddos don't like those, but you can disguise them in a smoothie. You get that high good fat in a smoothie. Then also like heavy cream in a smoothie. My dietitian will suggest that, or even oil. Nuts and seeds, of course, are good high fat, and then the nut butters. You can dip your apple in peanut butter or almond butter or anything like that. Good fatty fish is something good. Cheese is liked by lots of kids, so cheese is a good one. Eggs are good, and of course lean meat. Those are some that come right to mind. But she does, like, the dietitian will come up with smoothie recipes that you just kind of sneak some extra fat in there, and it, really fruit smoothie that's good and refreshing and kids will like. That's the main thing is liking the what you're eating. So those are some good options for sure.
Well, hopefully we've started people down the path of what can I make and given them some good suggestions for that.
Yeah.
Have you heard of any Trikafta side effects with any of your patients or nationwide as this drug is continuing to be used?
Well, the main thing we're seeing a lot, because you have to check liver enzymes. You get a baseline prior to starting the med, and then you have to have every 3 months a lab draw. And the liver enzymes with Trikafta have been relatively high. So basically, high enough that we need to repeat the lab and not necessarily stop the medication. But it is something that's kind of really on our mind because it's irritating the liver in some cases a lot. So that is something that we watch quite closely, and we're having to check those, repeat those like monthly on a lot of patients, which is, it's they are willing to because of how good they feel, but the long term, we're wondering what that's going to look like. So watching that really close. Other than that, there has been different things that are transient that will, like, when things start moving again, they'll have abdominal pain for a little bit, and it's pretty transient. It does it lasts for a little bit and then it goes away. We had some headaches, like dull headaches that not like Tylenol wouldn't cut, wouldn't do anything about, but that also went away. So just little things that are just at the beginning of the treatment. Although diarrhea has been one that has kind of held on. It's a side effect that's held on for some. So it does affect everybody differently. We just kind of never know who's going to be affected by what. So
so Diane just asked a question about depression, and I was going to ask about mental health as well. I know that it's a focus of the foundation to continue the mental health checks with the patients, as well as people are getting older and living longer, they obviously have a lot that goes along with CF. So can you talk about what you guys do for mental health?
yes, and I feel horrible because I left my social worker out of my staff. So I'm glad you asked this question. So yes, we have our social worker who is so very important to our team. She is available every visit and will go in. Basically, she will call anybody she knows has had questions, or she is very available at all times. They can call her and discuss things, but she goes through depression screening with as soon as they're 12. They can fill out one of her depression screens, and then of course up to adults, and kind of gives her a gauge on how they're feeling and what, if she needs to take things further and help them find somebody to talk to on the outside of the clinic. We have some patients that we're partnered with a psychologist that is just right within the atrium where our office is. That's just wonderful, and she's been there so long, so she is familiar with cystic fibrosis. So that I feel is key to understanding what is going on. So Michelle is our social worker, and she's just available at all times. And there's where you think Trikafta is such a great thing, then they didn't plan on this being to go to college and stuff like that. So different things that you didn't think of coming up are coming up, and she's there to address things. And she really focuses or works as like a mental health coordinator, because she's not only here to counsel them and kind of, if that's all they need is to talk to her, that's great. But she has lists of people that they can talk to and find somebody that works best for them, so that, because they need to talk sometimes. So definitely a very important topic. I feel bad I left her out of my staff.
Well, that's all that I have for questions from the chat and from myself. Did you have any other last items you want to talk about, Amy?
The only other thing the hot topic right now is school, and that kind of goes right along with mental health. We are, our families are, they're all over the state. So every school is different, every patient is different, and we're here to function as support in whatever is decided if they go back to school. It is not feasible for everybody to stay out, where we, definitely feel that would be your safest option to do distance learning, but that isn't an option for everybody. So we're here to literally support, and, if you're kind of on the fence, I just kind of give things to think about and discuss, is how important mental health is as a child. The socialization, the being around their friends, that is equally important, as their their health and really communicating with the school to find out the safety precautions they're putting in place so that, you know, they, if needed, can come up with a 504 plan so that they have a plan for their child so they can feel safe if that's the only option. And just really giving them all the options and not, you know, making them feel like what their decision is wrong, because this is going to be so difficult for everybody, this decision. And so we're really here to function as support in whatever the family has to do, because we know one solution isn't right for everyone. So that's just, school has been a really hot topic. And yeah, so I know everybody's not alone if that's a difficult decision. Everybody's having a hard time.
We have another good question from Dan. Dr. Boyle and the foundation launched the 5 Years to a Cure initiative.
Yeah.
In your opinion, is this a realistic goal?
Oh, I hope so. In my opinion, I don't know, because, I mean, honestly, I don't have the scientific hat like that is needed to see that. I am hopeful. They've come so far so fast that I feel that the support behind it has grown so much, so that I think can make it possible. I guess faith is what you need, and I feel that, you know, who would have thought we'd be where we are now? So yes, I guess that's, in short, I would say yes.
Well, we are all hoping for that, everybody.
Yes.
You know, someday we wake up and we don't have a job anymore at the foundation. That would be the ultimate dream.
Right?
So.
Yes.
Well, we don't have any more questions right now. I'll give it another minute or two, but Amy, we've really appreciated hearing from you. I always like hearing from you and our team. Mary and Dean, did you have anything else? Don't forget.
I don't believe so. Wow. I've got a lot of notes. Thank you, Amy.
You're so welcome. And if anything comes up, send it my way. I kind of ramble. So.
Well, and that's really why I wanted to record this, because I think there is a lot of good information in here and it might spark other questions moving forward.
Yeah.
So I will get this recording out to the group, and if you do have any other questions, you can always funnel them to me or anybody at the chapter, and we can get them to Amy. So we are hoping for our next Grampions call to be on August 25th. We are still working on a topic, but we'll share that with you guys very soon. So I'm going to stop the recording, but thank you, Amy, for all of your time and answering of your questions.
Yes, thank you for having me.